to what Dr. Cagle said with the busing issue, and certainly the vaccination, the boosting, wearing a mask when you're in public, and be careful about what you do and where you go. The other thing I'll tell you is please do not come to the emergency department just to get tested for COVID. Those with true life-threatening emergencies need to come to the emergency room with illnesses and injuries. And we actually are seeing patients coming in for other problems that test positive for COVID-19 now. We really would like you to stay at home as possible as you can and use virtual options like we're doing today. 24/7, there's access to speak to all of our systems emergency medical specialists, either by video or phone, or ours is www.wakehealth.edu/getcare, and Cone and Novant have similar opportunities. We have staff there that can direct you to where you need to go. And we are unique that in here, and our academic mission is being affected too. You know, we're trying to continue to train PA students and nurses and medical students, and we're trying to get them on the other side of this so that they too can be healthcare providers. We have record numbers of applications to our schools this year for MD and PA and NP. People still want to take care of you, but we actually need to get through this latest surge. So do whatever you can do to keep yourself and your loved ones safe, especially those immunocompromised, those patients that have had transplants or have cancer. It's so important that you get boosted and so you can stay out of the hospital. So thank you for taking time to listen to us today.
Thank you very much, Mr. Amato.
Well, thank you, Doug, and Mary Jo and Julie. Thank you for the opening comments. And good morning, everyone. I just appreciate everyone coming today with the goal really to reduce the spread of COVID-19 in our communities. You know, this pandemic has proven that we're truly all in this together. And that's why you'll see Atrium Health, Novant Health, and Cone Health all together. And I'm just grateful for the continued community support. I'd like to start out by just thanking all of our local healthcare workers and frontline workers, as well as their families, for their efforts, particularly over the past 2 years that we've been fighting this pandemic. You know, it requires tremendous courage, compassion, and teamwork to face something as threatening as COVID-19. And our team members and frontline workers have been really fighting this pandemic, serving our communities, and they're proven day in and day out to be the heroes by delivering life-saving care in really unprecedented circumstances. You know, and for the past 2 years, these remarkable individuals have made endless sacrifices. But I have to tell you, well, as I round, they're tired. They're tired of being heroes. And we need to remember that they're more than just healthcare heroes and workers. They're wives, husbands, brothers, sisters, parents, and children. And today, all three of us are really asking our communities to help those heroes who are exhausted from caring for unprecedented number of patients who have seen more death than the rest of us can ever imagine. We can't thank them enough for their dedication to providing compassionate care, but today they're asking for more than thanks and gratitude. What they're really asking for is for all of us, each one of us, to help reduce the number of COVID cases so that they can deliver the remarkable care under a more reasonable circumstances. They're asking us as our community, each one of us in our communities, to be heroes. You know, as president and CEO of Novant Health, I'm here asking all of you today to please do your part to just a bit to relieve our teams who are working so tirelessly to care for both COVID and non-COVID patients. You know, through widespread vaccination, we can simply reduce the burden on our medical centers so that we can have more resources to care for you in the case of an emergency. You know, we want to be there for you when there's a car accident and a family member suffers a stroke or a neighbor's having a heart attack. We want to make sure we've got the capacity to provide you the remarkable care that each of you deserve. We want to be ready to care for you to the fullest extent. So again, I'm here pleading with the public to please receive your vaccination if you haven't already done so. And really, if it's time and you're eligible to receive a booster dose, do it as soon as you're eligible. Vaccination is our most powerful tool to help curb the spread of this virus. Numerous studies around the globe have confirmed the safety and the efficacy of these vaccines. And look, I'm a CPA, so I have to really look at numbers, and you have to look at the numbers, and it's the simple truth is that these numbers are telling us that vaccines make a difference. So please, let's do what we can to ease the spread of COVID-19 to provide some relief for our healthcare teams. First and foremost, it's really imperative that everyone get a vaccine if they haven't already done so. And if you have already been vaccinated and eligible for a boosted dose, please ensure you get your boosted dose. Data continues to show that the third dose of either the Pfizer or Moderna vaccine provides a significant boost in protection against the Omicron variant. You know, at Novant, we now have over 500 patients in the hospital with COVID-19 system-wide. And yet, I'm here to tell you, with our own numbers, 80% of those patients are still not vaccinated. So if you look at what the CDC is putting out there, getting a vaccine booster actually restores vaccine effectiveness against infection to 75% again. So this not only protects yourself and those around you, but also protects our frontline workers from being exposed or transmitting the virus while they're caring for patients at our facilities. All COVID-19 vaccines available in the United States have shown to be safe and effective in preventing COVID, as well as reducing the risk for hospitalization and death. Secondly, when we're in public spaces, I think Mary Jo and Julie both said, we've got to do what we can to help protect others by wearing masks, remembering to thoroughly wash your hands as often as you can, and maintaining proper social distance from others when possible. And do your best to avoid spaces without significant airflow and where people are not wearing masks inside. Lastly, you know, if you have a neighbor who's a nurse, a physician, or just a friend or a family member that works in healthcare, take a moment to let them know how much you appreciate them and all of their efforts. A little bit of praise, a sincere gratitude right now really does go a long way. Thank you for allowing us to speak to you today.
All right, thank you very much. Now it is time for the media. Don't forget, media, that this is being recorded, and a link will be sent to you shortly after the completion of today's virtual news conference. Members of the media will go ahead and ask questions using the raise your hand feature. What happens then when I call on you is that you will need to remember to unmute yourself to ask your question. So we will see what we get coming in. All right. Richard Craver has questions, he says. So Richard, why don't we go ahead and begin with you, and don't forget to unmute and who you're addressing your question to, whether it is one particular CEO, all of them, or some combination thereof. Richard?
Can you hear me?
Yes, we can.
Okay. Not to sound cynical by any means, but certainly the message that y'all presented today has been cited by public health officials, infectious disease experts, local officials, and the like. So who do you feel like is going to be receptive to your message today that hasn't been receptive before? And that's to anybody.
Yeah, Richard, this is Carl. I'll just tell you, I think we're just at a point, though, when you start to hit a positive case rate at close to 40%, and you're starting to see the kind of impact that we're having on our communities. I think what I think we were trying to do today is really just let people know what we're experiencing locally. You know, a lot of times people get caught up in the political discord around whether, you know, vaccines and looking at information coming from a national, place. And what I'm saying is these are local numbers. This is local information, and this is impacting our people in our community. And we're really thought we should just take the moment to make sure people knew locally what's happening, so we could really just share that with people and the impact that it's having on all of us as healthcare workers. And so I think Julie and Mary Jo did a great job of highlighting just the infrastructure and the impact it's having on the infrastructure throughout all of the industries in our communities.
And I'll follow up with that, Richard. It's now getting personal. You know, last week I operated on 2 patients on Thursday that I'd seen in November to December, and we could schedule them. But on Friday, I had a patient not come to clinic because they were exposed. I had another patient not make it because of snow. And I had a patient that I had to say, well, your surgery needs to be done, but I can't do it in the next couple of weeks. We're hoping we can do it the next few weeks. And hers is elective, but she'd like it done now because she's a professional and can't work. And we're also seeing patients come in with acute issues that we're worried we're not going to be able to take care of you, and it's getting personal. And I actually heard from some family members saying, why can't you take care of my loved one? You know, and I think that's the piece that we don't ever want you to think about, that we have to look at elective surgery the next couple of weeks, and again, temper our enthusiasm so that we have beds and staff and to make it happen. And it is personal. It's personal with your kids going to school, with the example Dr. Cagle gave with the busing. It's similar to the restaurants where you go, where you can't get your service as quickly, or there's only one line at the grocery store to go forward. That's happening now in your healthcare access too, where clinics are going to have to close. You may not get that appointment you want, or if you have elective surgery all set up, that it may not happen. So that is the urgency right now, is we're seeing an incredible increased number of patients that need to be in hospital because of COVID, though those are in the hospital with something else with COVID. And as Carl said, so many of them are unvaccinated. So that's where we want to make sure people know you can make a difference if you fall in a category of someone that needs to be boosted, vaccinated, or watch where you go and how you behave in different public scenarios.
So the only thing I would add, I think that both Julie and Carl did a great job with that question, Richard. We are not political people. We want people to know that it is all of your health systems. It's all of the hospitals in your area, and it's more than the hospitals. It is the entire safety net structure in your community being affected. And it is going to require all of us working together so that we can keep you safe. We're healthcare professionals, and our entire life has been about serving others and keeping our community members healthy and safe. And we are telling you that we're at a point that we need the public to hear us and help us so that we can continue our mission, a mission that we take very seriously.
Thank you, Dr. Cagle. Jenna, I see your hand in the air. Don't forget to unmute as you ask your question.
Hey, good morning. Can you guys hear me okay?
Yes, we can.
Awesome. Thank you. Thank you guys for spending some time with us this morning, and kind of whoever wants to tackle this. But what do you think the next couple of weeks and months will look like, especially if people that you are pleading with today don't follow your message or don't take these preventative measures, and we don't see those vaccination rates go up? What do you think the future or next couple months and weeks will look like, especially in the hospital systems? Thank you.
Well, maybe I'll start with that. You know, the best case scenario is we think January is going to be really tough. You know, we don't anticipate much difference because, as you know, when you get infected with COVID, the lagging of coming in hospital, staying in hospital, and get you home is there. So we don't anticipate that. We're hoping that come February, we could sort of see some decreased numbers of people to participate. But if you talk about people across the entire country, there's some areas that are even more affected than us. My sister-in-law is a nurse in Milwaukee, Wisconsin, and their numbers are even worse than ours right now, probably because of the bad weather and everyone having to be inside to make that happen. It's been -5 degrees there. So I think the best case scenario is hopefully we can get through January into February with a little better, and we're hoping to be able to turn that around. But if we don't, we may continue for even an extra few months with the same type of scenario. But we're waiting to see whether or not people actually do pay attention and are able to go back to the constraints we need you to do, even though we don't like them, you don't like them, to make it happen.
So our modeling does show that this should continue most of January and should get better in February if we follow the modeling of what Omicron has done in South Africa and Europe. So we're hopeful that it'll get better in January. And so that's at the end of January into February. If people would help us and do this, it certainly will be better by February.
Yeah.
So
Mary Jo,
that's why we're making this request. Go ahead, Carl.
No, I think that was, you and Julie highlighted what the big fear is when you look at these predictive models that we have, and it shows that the Omicron variant is just so much more contagious than other variants. Now, we may not see as many hospitalizations as we saw with Delta, but I'm just saying, if you look at how Omicron is spreading at the rate it's spreading, we still will have significant number of people that, particularly in January, that will be in our facilities. And I'm worried, Julie mentioned it early, I'm worried about the people that have and need healthcare services other than COVID. I mean, if you have to start shifting and moving team members to cover just COVID patients, and we don't have all of the capability that we need to deliver care to everyone else, that's where there's a real concern, particularly for January, if people don't really help us and engage to really reduce the spread of this Omicron variant.
Well, and the issue is because it's so infective and we're bringing them into our hospitals, we're having our employees become infected. And so we're having high absenteeism. And so our resources are spread very thin.
We have
And
hundreds.
so
Yeah, we have
that's
hundreds out
becoming an
too, Mary
issue.
Jo.
Go ahead, Julie.
Yeah, we have hundreds out also of staff, and hundreds every day getting tested. I know you guys do too, of staff that have been exposed or have symptoms. And that's exactly what you're saying, Mary Jo.
Yeah.
Thank you, Dr. Feischlag. Ford Hatchett, I believe you have a question. Don't forget to unmute.
Hey, good morning. Thank you for doing this. This is Ford with WXII. You've kind of hit on this a little bit already, and this is for anybody, but more and more we're hearing from people, hey, I've been doing this for 2 years. I've been doing everything right. I've gotten my shot. I've worn my mask. We're still getting it. I'm throwing my hands up, and I don't think, Omicron's, I'm seeing mild cases. I'm going to be okay, right? I'm done. I've been doing everything you've asked. What's your message to those people to try to get them to hold on just, another infinite amount of time longer?
Well, maybe I'll start with that. I hear it that if you're a healthy person and you're doing all of that, that you maybe to say, I'm tired. But we're seeing an increased number of children now getting infected. We have more children in the hospital now than we ever have, those that can't get vaccinated. So those people, even if you think you can go ahead and do what you want, you'll just get a light case of the COVID. You've got children in your house. You have older people that may be immunocompromised, those with cancer, those with kidney transplants, those that have other diseases that actually you could infect too, that actually you could hurt them as well. So I guess my thought is maybe it's not all about you, maybe it's about all those people around you, the children that need to go to school, the older people that are immunocompromised, those that are scared to death because they have cancer or are undergoing treatment, so they feel very scared to go outside. I think those are the people that you need to worry about. I actually was the first person randomized in the Moderna trial here in August of 2020. And I went into that trial because I wanted to know the answer. Both my husband and I did. And then we found it out in January that, I actually had been vaccinated. So I've been vaccinated now for 1.5 years to do that. And it was really important to go forward to protect others as well as yourself. So I think that's the other thing we want you to think about is everyone around you. Think about those high school kids that have to take a public transportation to get to school. Think about the little kids that can't go to school or the ones that have to wear masks every day in school. I know my granddaughter actually knows that she has to get a nose test every week for her to go back to daycare and how that has affected her every week as they come out. So I think this is more about everyone around you and your community rather than just you.
Yeah, Julie, I really want to emphasize what you just said, because as a type 1 diabetic, since I was 18 months old, I was thinking about if I had to go to school and as I'm out in public, it really is about all of the people that bring some other form of comorbidity or disease that they've been struggling with, whether that be cancer or diabetes, or I was thinking about people with AIDS and other things that who are suffering. I mean, we need to protect all of our people, our senior citizens. And so I think it is more about just about whether one person is going to be okay. It really is about how do you protect the whole community. And I love the fact, Julie, that you highlighted the fact that there's so many people that need us to really do our part to protect them.
Very good. Jenna, I see your hand is up for another question, please.
Yes, thank you. I actually have two quick ones. The first one is, what has testing looked like for you guys? What efforts? I know there's been efforts to make testing more readily available, more sites. I know there was a new one over on Friday or over the weekend here in Greensboro. What does that look like for you guys? And what are you efforting to keep up with the demand there? And then also, I know it was a kind of at the beginning of the pandemic, they were saying, wait, if you've had COVID, wait a certain amount of time to get vaccinated. Has all that changed? If you just had COVID, should you go ahead and go get vaccinated? What's your message there? Thank you.
Well, I'll go ahead, Mary Jo. You go this time.
So efforts, I think all of us are looking at all kinds of efforts to have sites and appointments, increased appointments for both testing and vaccinations away from our hospitals and emergency departments. Thus, the mass vaccination site that's opened up at the Greensboro Coliseum, but also I'm sure on all of our websites, but for us, it's conehealth.com/testing. There are over 5,500 appointments per day for testing, and we still have our vaccination sites going. So I'm certain my colleagues have similar sites. I know that Julie listed hers earlier. We are all doing that. And when we can get therapeutics for monoclonal antibodies, which are in short supply for everyone, we are still doing that daily. But those are in very short supply right now nationally.
Yeah, Jenna,
so we're doing that. Carl, go ahead.
Yeah, thank you, Mary Jo. And like both Cone and Atrium, I think Novant Health now has 140 sites where you can either be tested and or receive a vaccine. And you can go to novanthealth.org/COVID test, or you can go to novanthealth.org/coronavirus. And really, we've got the Haynes Mall site that you can actually schedule a quick appointment and walk in. It's the old Sears building at Haynes Mall. So we've got mass vaccination sites, but I would say many of our primary care sites are available for both testing and vaccinations if you need to access a primary care physician. And look, if you go on our website and you're not a patient, you can still we'll still test you and provide the vaccine through that website. So just feel, if you're not a patient, don't feel like you have to be to get your vaccine.
Yeah, and similar www.wakehealth.edu/coronavirus will make that happen for you. And so I think part of it is, make sure you get an appointment so you don't have to wait as long. But, we've been telling you we're short staffed. And so that's what's making it hard too, to even get the testing and getting you your vaccine. So as we keep getting more vaccines and having people behave better in public, we'll have more people to help with that. If you have gotten COVID, people mainly depending on all your other attributes, whether your age or your other comorbidities or whatever, it's about a month you should wait. You get through the disease and talk to your doctor or your healthcare provider about when you can start the vaccine following that. But certainly you still need to get the vaccine. The virus itself does not protect you adequately as we go forward, certainly with all these new variants and things to do that. But once you get through all of that and get yourself feeling better, talk to your healthcare provider to quickly set up your vaccine appointment.
We have come to the end of our allotted time for questions. Right now, we'll go and do some final thoughts. Dr. Cagle, please begin.
So I want to thank you all for being here today and thank my colleagues again for joining me. We want to really emphasize to you all that our communities are at a critical time. The infrastructure in our hospitals are really stressed. Our healthcare providers are stressed. They are starting year 3 of providing this care for this worldwide pandemic. They are exhausted, and yet they continue to come every day and do this. Our infrastructure in our communities is stressed. And so that our communities can continue to get both the health care they deserve and the emergency services that they deserve and have come to depend upon, we are asking for the public's assistance. We're passionate about the care that we give every day, and we want to continue to be able to give it. And to do that, we need the partnership of the public to do that. So please wear your mask. Please get a booster shot. Please get the vaccine. And I want to thank our county councils who have continued to call for a mask mandate. We appreciate their support in doing our important work. Thank you all for being here today.
Thanks, Dr. Cagle. Dr. Freischlag.
I totally agree with Dr. Cagle, and I thank you. And we also know everyone else is frustrated and tired too, no matter what your role is, where you are, whether you're taking care of kids, older people, your job, whether you're facing people every day in a restaurant or a grocery store or retail. Oh, we know everyone's really tired, but we need to carry on to get through this, wearing our masks, getting vaccinated, getting boosters. And then we know there's been some mental toll on all of us. So we need to make sure that you take care of that part of you too, whether it's just talking it out with a friend or family member. It's okay to just be crabby about it and just sick of all of it. There's days that I just don't want to have to deal with it anymore. We know that, but make sure you get care for that part of you too, that you know that we're all in this together. We can get to the other side of this because there's so much hope as we go forward to all the things we've learned about taking care of the pandemic that will be even better in the future if it were to happen again. So take care of yourself, not only physically, but also mentally as well. And again, thank you for listening to us today.
Very good. Mr. Amato, you have the final word.
Well, thank y'all, and thanks to my colleagues. And, you know, as you listen to the questions, the questions bring a lot of, you still hear a little bit of the social and political discord around vaccines. And I think we've gotten lost about what's truly at stake when you think about trying to control the spread of this virus. I mean, we're trying to save lives, and it's heartbreaking, but I'm going to share just a quick story about a family friend. And we all have these friends who was just 38 years old when he passed away from COVID-19. He was a husband, a father, a son, and friends to many people. His family lives on every day thinking about his loss. And I think about his young children and how, whether or not they're going to remember him. And this unfortunate reality is so true for so many of us, that we all have these similar stories, who we lost friends and loved ones and coworkers. However, there's a silver lining that's helping us battle this pandemic. And we have the knowledge, the experience, and really the resources to prevent death and hospitalization. And it doesn't have to be this way. We have multiple safe vaccines and effective vaccines that really can protect and have protected millions. And we need to ensure that we're utilizing them to the best of our ability. So on behalf of the families who have lost someone to COVID-19, please, let's come together, do our part to avoid more preventable deaths. And thank you again. And I appreciate your ongoing support of our efforts really to reduce the spread and to protect all members of our community.
Thank you, Mr. Amato. Thank you, Dr. Freischlag. Thank you, Dr. Cagle, for taking part in today's virtual news conference. Again, this is the first time that the three leaders of our leading healthcare organizations in this area have appeared together in something like this to show you the gravity of the situation that we all face. Once again, members of the media, you will receive a link, hopefully soon, a recording of today's news conference. And of course, you know how to reach your fellow PR folks on the other end if you have additional questions. Thanks again. Have a safe day and a healthy day. Take care.
Thank you.
Thank you.